咁其實如果有性功能障礙嘅患者，佢有啲乜嘢方法可以醫治呢？咁究竟坊間嘅口服藥同埋坊間嘅針劑療程，其實係咪真係咁好效果呢？咁我哋今日好榮幸邀請到中文大學內科及藥物治療學系湯靈信教授上嚟為我哋講解下性功能障礙藥物嘅治療方法。Professor Brian Thomason, please.
Good afternoon, ladies and gentlemen. Come from the Department of Medicine. In fact, I'm a clinical pharmacologist, and I'm going to focus on some aspects of the medication for the treatment of erectile dysfunction. And Norman Chan has already given some introduction on this. First of all, we should consider what we mean by erectile dysfunction, what is the definition. And you can see here that according to the National Institute of Health in the United States, they say it's the repeated inability to get or keep an erection firm enough for sexual intercourse. And the causes can be divided simply into psychogenic or organic, or often a mixture of the two, psychogenic and organic. And the risk factors for erectile dysfunction, again, you've heard very much from Dr. Norman Chan already that diabetes is one of the major problems which results in erectile dysfunction, and it's becoming increasingly common here in Hong Kong. And in addition, hypertension, high cholesterol, various types of coronary heart disease, smoking and obesity. All of these things are very common risk factors for erectile dysfunction. Now, again, Dr. Norman Chan has already described to you the mechanisms of penile erection and erectile dysfunction, and I'll just go over this again fairly quickly with this diagram. The diagram here shows the arteries bringing blood into the penis and the veins which drain the blood out again. And shown in yellow here are the nerves supplying the penis. And these two cross sections here coming from that area show the penis in the flaccid state and the erect state. And the mechanism of erection involves a relaxation in the smooth muscles which surround these blood-filled spaces called trabecular spaces, and also dilatation of the arteries. So in the erect state, the penis looks like this with the sinusoidal spaces filled with blood, the arteries dilated, and this in turn compresses the veins which drain the blood out. So that again tends to increase the degree of erection. Now, if we look at the underlying molecular mechanisms of penile erection, we can understand why certain medications will be effective. This diagram shows a smooth muscle cell from inside the penis. And you can see there are various nerves which act on the smooth muscles, and they have different effects. The sympathetic nerves release adrenaline or noradrenaline, and this stimulates alpha receptors on the surface of the cells to cause contraction. There are also cholinergic nerves which release acetylcholine, and they may facilitate the release of a chemical mediator from the endothelial cells called nitric oxide. Nitric oxide is also released from some other nerve endings directly. And the nitric oxide has an effect to activate an enzyme here in the smooth muscle cell called guanylate cyclase, which produces cyclic AMP, or cyclic GMP down here. Up there we have cyclic AMP, which is stimulated by adenyl cyclase. This in turn is stimulated by certain prostaglandins, prostaglandin E1, so that increases in the cyclic AMP and cyclic GMP promote relaxation of the smooth muscle. And this is the major mechanism of penile erection. Now, as you've heard already, there are various different treatment options for erectile dysfunction, and one might consider, first of all, certain oral medications, and then there are injection therapies, and I'm going to focus particularly on a mixture of 3 medications called Trimix. You've heard already that there is a preparation which can be administered in the transurethral route called alprostadil. There are various physical means of treatment, such as a vacuum pump, or in really difficult cases, one may have to resort to surgical treatment with implants of various devices, or perhaps surgery to improve the vascular supply. And of course, we must not forget that many patients will need psychosexual therapy, so that is still a very important consideration in quite a lot of patients, but I am going to focus very much in this talk on the injection therapy with Trimix. So, considering the oral medications, I think most people are familiar with the medication sildenafil or Viagra. It's become very widely known in recent years and very commonly used. And there are 2 other very similar treatments. Again, Dr. Norman Chan described these and how quickly they work, how long they go on working. So there's tadalafil or Cialis and vardenafil or Levitra. So these are the 3 medications which are phosphodiesterase type 5 inhibitors. In fact, in medical practice, these medicines also have been found to be useful in the treatment of pulmonary hypertension, a peculiar condition affecting the blood supply to the lungs. But again, because these are taken orally and they affect all of the body, one might anticipate there will be some adverse effects. And perhaps the commonest adverse effect will be headache, and then maybe flushing, nasal congestion, and again there are other things like muscle pain and backache. But perhaps it's more important to consider that there may be serious cardiovascular events, and patients with heart disease sometimes are taking medications called nitrates, and these interact quite strongly with this group of medications and may cause severe lowering of blood pressure and sometimes loss of consciousness. So that's a very important thing to think about for patients who may be using these types of medication. And the other medication to mention at this stage are the androgens, particularly the male hormone testosterone. In some patients with erectile dysfunction, this hormone may be insufficient. They may not be making enough of the hormone themselves, and in that situation, it would be appropriate to replace it. And it can be given as an oral medication, or again, as you heard in the previous talk, it can be given by injection, and indeed there are some other preparations which are put on topically. Now, for the medications that are given by direct intracavernosa injection, it has been found that using a combination of 3 different medications, which is called Trimix, this one called Trimix, seems to have the best balance between beneficial effects and adverse effects by using this combination of 3 medications. And I'm going to describe this by describing certain clinical studies with this mixture of 3 medications, and I'll talk a little bit about the adverse effects and complications that may occur. So the intracavernosal injection has to be administered very carefully into the penis directly. This is an alternative to oral medications. And the trimix preparation is a combination of 3 different medications combined together in the one injection. So let me explain what these 3 different medications are. Papivirine is a medication which has been used for a long time to treat erectile dysfunction. It causes the smooth muscle in the penis to relax and allows the sinusoidal spaces to fill up with blood. When it's used by itself, it has a relatively high side effect profile. It may cause various side effects, and so it's better to combine it with other medications in smaller doses. The second one is the prostaglandin E2. This is marketed in certain preparations which have approval by some regulatory authorities to use as single therapy. It again acts as a smooth muscle relaxant. It's injected in the same way, and it was the first one to be approved by the American Food and Drug Administration. The third medication is called phentolamine. This is a medication which inhibits the alpha receptors. It's an alpha receptor antagonist, so it reduces the effects of noradrenaline, which are vasoconstrictory. And it will increase the nitric oxide supply. And again, it works by inhibiting the signals from the adrenergic nerves. So these 3 together are used in the trimix preparation. I'll show you the benefits of this mixture in the next few slides. This slide shows a clinical study in 625 patients with erectile dysfunction. They were treated with different types of direct injection, starting with 1 drug and moving on to 2 and then 3. And you can see here those that just received the single medication with prostaglandin E1, about 1/3 of them get a satisfactory erectile response, but there's quite a high proportion of side effects. The side effect is pain at the site of injection. When a combination of 2 medications are given together, the result is better, and in fact, by combining the medications, the side effect becomes less because they're using smaller doses of each. And in fact, using the combination of 3 medications in the preparation called trimix, 94% of patients could achieve satisfactory erection. And again, the side effect of pain was very infrequent by using this combination. Now, it may be interesting to consider how we should manage older patients with erectile dysfunction. And this study in elderly patients looked at 300 patients with erectile dysfunction. The average age was 67, but it extended up to 85, so some of these patients were quite elderly. And you can see it's a comparison of using the prostaglandin E2 by itself, and in these patients about 48% had satisfactory response, but 11% had the side effect of localized pain. Whereas with the trimix, the 3 medications mixed together, about 3/4 of the patient have a satisfactory response. And again, the side effect of pain is less frequent. So the treatment appeared very effective in these elderly patients who have organic impotence. Now, this is a study in patients who had developed cardiovascular disease of the heart, or some of them had also had stroke. And these patients, after developing these cardiovascular diseases, developed erectile dysfunction. And they were initially treated with sildenafil, Viagra, to see if they responded. And as I mentioned, that needs to be done very carefully in these patients because they may have adverse reactions. But there were 113 patients who had no satisfactory response to sildenafil, and they were treated with the intracavernosal injection of Trimix. And you can see out of those patients who are not responding well to sildenafil, 3/4 of them have a positive response to Trimix. So a very good overall response. And the side effects seen here are quite uncommon. Priapism or prolonged erection occurred in about 7%. Small nodules at the site of injection around 6%. And bruising occurred in about 8% here. And that's partly because some of these patients are taking an anticoagulant drug called warfarin. So Trimix seems to be very effective in patients who have underlying cardiovascular disease who don't respond very well to sildenafil. This slide describes another study in patients who were already established on the Trimix injections. They were invited to try the oral sildenafil as an alternative, and quite a large proportion, 52 out of the 69, did show positive responses. So they had a response with the oral medication, but when they were asked which they preferred, about 3/4 of those who actually responded to the sildenafil still preferred to have the injection because they found that it gave a better, more reliable, and a more rapid onset of erection. So overall, there seemed to be an advantage to these patients to continue to use the injection treatment. And in fact, another advantage that was noticed was that these patients also started to develop spontaneous erection more frequently when they were treated with Trimix. And this is another study in 189 patients with functional erectile dysfunction. They had various underlying diseases, vascular disease, diabetes, and neurological disease. These are common causes of erectile dysfunction. These patients were given Trimix treatment over a period of time, and you can see 92% had a positive response. So the response really was very encouraging here. Very high percentage have this response. And in addition, over 7% also develop spontaneous erection. So they seem to have an improvement in their erectile dysfunction over a period of time. The other side effects that occur are some localized fibrosis at the site of injection and the prolonged erection or priapism. So overall, the Trimix injections were very effective in this group of mixed patients, and quite a large proportion do regain spontaneous erection. So if we think about the adverse effects of this form of treatment, perhaps one worrying problem will be pain at the site of injection. This is particularly common if we use the prostaglandin PGE1 by itself as monotherapy, and particularly if we use high doses of that. And so this problem can be minimized by using the combination of Trimix. Another problem that we always have to be cautious about is prolonged erection or priapism. We don't want the patient to have this problem going on too long. This can usually be avoided by very careful instruction and dose titration, and so it's really a problem that can be prevented by proper advice and care of the patient. The third problem is fibrosis, a sort of thickening of the tissue at the site of injection. This will occur in a certain proportion of people, depending on what drugs are used and how it's been used. It has been a problem if papaverine is used by itself. And so again, it can be limited with proper injection training and the use of the combination treatment. And lastly, in a small proportion of patients, there may be hemorrhage at the site of injection, and again, that can be limited by the proper training of the injection technique. So overall, you can see that this injection of the 3 medications together called trimix is very effective in relieving the erectile dysfunction, and the side effects are quite uncommon and can be largely reduced by proper training of the patients. So thank you for your attention.
Okay, the question is, what age group is suitable to use trimix therapy?
Well, I suppose the simple answer to that is any age. There are really very few or almost no contraindications, and age in itself is not a contraindication. I've shown you data here in men up to the age of 85, and I think even 85 is not the oldest that we could use this medication in.
It is very costly to use trimix therapy.
I suppose the answer might be it should be worth it to the patient.
Exactly. How long does it take for the whole treatment?
That's slightly difficult to answer in a way. The treatment works straight away, of course, when the patient is given the injection. Now, the patient will need some training, and this may take minutes or hours, depending how quickly the patient gets the idea of the procedure. And many patients will want to go on using the trimix for several months or even years. So the answer is that it works very quickly straight away, but the whole process may go on for a very long time.
Thank you, Professor, for a very enlightening lecture. I would like to know what exactly is the technique that you will use to minimize the occurrence of fibrosis. And secondly, for patients on anticoagulants, can they still use trimix? Thank you.
My experience is in the way that medications work. I'm not an administrator of the medication, so I can't tell you exactly how the administration is perfected to avoid the fibrosis. Although, as I mentioned, one of the important things is having the right mixture of medications together. For instance, if one just uses high doses of papaverine, that's more likely to cause a fibrosis. So that's one aspect, and I think the team working in the company here would be better able to describe the techniques to avoid the fibrosis. But your other question about the bruising, if there are patients on warfarin, that may well be a problem. Patients on warfarin, particularly if they're treated so that the anticoagulation is quite marked. If they have an INR which is perhaps nearer to 3 than to 2, they would be at some risk of hemorrhage. So that may be a problem. Of course, there are many other patients nowadays on other types of antiplatelet drugs, particularly aspirin and clopidogrel and the various other antiplatelet agents, and they may be at some increased risk of hemorrhage as well. But the problem is not so bad as with warfarin. So I think if one has patients who are on warfarin or other forms of total anticoagulation, low molecular weight heparin or other forms of heparin, I think one would have to be very cautious in using this technique.
頭先想回應翻咧，阿 Dr. 係咪啊？佢個問題咧，或者我將你個問題轉達俾我哋嘅徐醫生 Dr. Daniel Choi， 係我哋漢陽男士健康中心嘅主診醫生咧，佢可以幫你答一答個問題嘅。
呢個fibrosis 咧就唔係好常見嘅，但係有。但係我哋嘅辦法咧就係 rotate 啊，輪流嘅地方打。你打死一度咧，佢有 fibrosis 嘅機會高啲。 你 rotate 下咧就少好多，而且我哋用嘅藥咧好少嘅，所以fibrosis 機會唔同，唔係淨係用pure 嘅 papillary。就另外咧就流血咧，好似打其他針一樣嘅，肌肉我都係 compression for a bit longer。我哋通常咧撳 3 minutes，maybe 如果你按 aspirin 啦、warfarin 啦，5 6 minutes，咁就好少有問題。
Can trimix help PE, premature ejaculation? One has to first of all consider that the nervous mechanism involved in ejaculation is not something that one would predict would be altered by the medications that are in trimix. And that's probably why if you look at some publication describing the different treatments for premature ejaculation, trimix may not appear there. But in fact, what happens in patients who are treated with trimix, there are many who do find that there is an improvement in premature ejaculation. This has been published several times. And one might understand that because there is quite a strong association between erectile dysfunction and premature ejaculation. The two often go together. And so if one's treating the underlying problem of erectile dysfunction, then the premature ejaculation again can be improved. And one might perhaps understand that in various ways. Maybe in some patients with erectile dysfunction, using the trimix sort of restores their confidence because it's such an effective treatment to overcome the erectile dysfunction. And then secondly, because the trimix treatment produces an erection that lasts for quite a long time, and it doesn't immediately resolve after ejaculation. So it's possible for the patient to try intercourse a second time. So there are many ways by which using the trimix does overcome the problem of erectile dysfunction.
好，唔該晒Professor。